as
Oh,
well, just as
great.
another person. So I'll speak with her today and see if
Oh, that'd be
she
awesome.
can reach out to you again.
Yeah, that would be great. And I was realizing from my note from last meeting, I haven't um reached out to the folks that were recommended to me either, so I need to do that. Um, Let me pull up the ASBE policy. I finally, as you can tell, got my act together and started working on some of these. Um,
I
let's
don't feel
see.
so bad suddenly.
Like, oh wait, we have policies I need to do here. Hold on a minute. I'm
Which
actually
one did
going
you
to
say you're
come
looking for?
off of camera because I'm going to be looking at really crazy things. So give me a second. And
It's the one that didn't open so far. It figures. Let me go back and see what it's titled. What's the title on that?
applied spinal biomechanic. I think it's ASBE policy is just how I.
Yeah.
And we have what's interesting about the kind of what I took from the original P&P is that there was no date on the ETSDP committee ruling. There was no, so I don't really know when it went before the committee. I don't know if this is really, if we need to have this policy.
Well, I remember. Um, oh, it was over 10 years ago. One of the docs had been really hard on pushing this as a policy of or a procedure that should be done or in the scope of practice. Um, and I know the discussion at that time was how much more reliable or unreliable this was versus traditional mammography. And that's what led to the development of a policy on this procedure on uh, was this breast thermography?
No, this was
Oh,
the applied
Forgive me.
spinal.
Never mind. My brain is still off kilter.
No
I'll go
problem.
back to sleep.
We'll
I didn't
get
want to
we'll
get
get to
up.
the we'll get to
Yeah,
breast
yeah.
thermography next.
I for some reason when it was small print, the biomechanic looked like breast thermography, so
Got it.
I'm not awake.
do we know if anybody in the area is doing this? I thought, did you research that last time, Seth, a little bit?
I mean, I looked around on the internet and Googled, and I mean, there are people that are doing it. And I think, if I remember correctly, I think there actually is someone here in Salem, I think, that teaches it.
Interesting.
But there's not a lot of information about what it is without, it's just very kind of general description. So, I mean, if we wanted to, I'm sure we could reach out to whoever it is that teaches it. And I think it was Salem and say, can you give us more information? But if it's still investigational, then.
Yeah, I don't know if that's necessary.
Yeah, I mean, I don't think there's any harm in creating this as a policy. I mean, we haven't gotten in the 10 years that I've been here, I haven't heard about anybody complaining or getting harmed or, this hasn't crossed my radar at all. So it's just one of those things where we could keep it. And just if something ever does come up, we have it and, there it is.
Yeah. And I mean, it states right there that you have to inform them that it's it's investigational and written informed consent must be obtained. So if you don't have that, you're, violating a policy. And if something happens and you don't have it, then you're really up the creek. So I think it looks good. That I vote for it to go forward to the board for review.
Yeah, I was reading a couple of the other ones, and I know on one, this is just picky little stuff, but the ETSDP, and one of them, it was in parentheses of what that stands for. And one of it wasn't.
Yeah.
And then some of them had, I don't remember which one, but that it was not taught at the college, and there, went kind of with the investigational. We don't teach this, but I don't know if that's necessary with this or just as is good.
Yeah, I don't think I want to get into the college piece, but I'm going to highlight this so I know to just spell it out. And so let me stop sharing really quick and I will save this. I'm glad it can make me laugh now, my saving snafu that happened. Okay. Hold on just a second, I'll pull up the other ones. All right. So as far as the breast thermography policy and its appendix. So what I've been doing, and let me share these, and they're going to overlap here for a second. I've been going through the P&P and literally taking just chunks of the text because like this, and I'm sorry, Tom, this is so small.
I got my copy up.
This was part of Appendix C, and I've been just doing away with it. I've just been deleting the appendices because they're just kind of not relevant, and I'm trying to just clean up that document. And so this Appendix C was the breast thermography definition and all these details that went into it, and then education, all this stuff, and then got into informed consent, and the informed consent imaging, this is what we're saying that they should be following or using. And then here's our policy that, if you remember, we went over the end of in 2022 and the board approved it in 2023. But my concern was it's referenced here, the appendix. And so I guess what I'm proposing to you is, rather than having it reference appendix, I can just attach the informed consent as a secondary document to this policy. So it's not attached to the main P&P body.
That works. I think that sounds, yeah.
I like that.
Is there anything in the appendix as far as consent that is different than what we normally have for informed consent, or is it just redundant of that?
That's a good question, Tom. It's just specific to breast thermography, which I found kind of interesting, that why we would take so much time to
diagnostic tool.
Yeah. We don't do anything else, any other modality do we do this for?
Like I said, I think it came about because of this push from one or two docs that were doing it or advocating it as beneficial in diagnostic or diagnosing potential cancerous lesions or breast pathology.
Yeah.
And I think there's just kind of an effort to over concentrate on that or to justify it. And that's why they put in all the superfluous material, at least what looks superfluous today.
Yeah.
Cat, go away.
So did the board, not me, the board prepared this at one point, the informed consent?
I think this was prepared many, many years ago when it first became an issue. It just seems to me very almost a CYA for the doctors using it. We are realizing that it's in addition to mammography, rather instead of mammography, and I don't know.
I don't think it's a bad idea to have it, just because in the policy it states that the FDA did not say that this was a standalone diagnostic tool. And if the physician that's doing this, which I can think of one that's doing it, maybe still, if they're not informing the patient of that, then that's a disservice. And they may be that mentality that believes that this is the end all be all. But if we, we can only handhold so much, but if we make it that is informative and the physician is required to inform the patient as such, I feel like at least we've done everything we can do under the auspices of our role as a protective organization for public safety.
Yeah.
Do we require those that do breast thermography to use that informed consent? Like if we audited an office that does this, can they have their own informed consent, or would they be required to use this that's in the appendix?
I mean, this policy says that they are required to use the what's in the appendix.
Okay.
Must use. Yeah.
Yeah.
Sorry, I didn't
So
read
that
that.
Yeah.
still goes back to the thing, is there anything in this informed consent that is significantly different than other aspects of it, that, or do we need just a statement that the provider needs to give informed consent highlighting the fact that this is experimental or something to that effect, and maybe have this form or something comparable to it available on the website as far as reference material?
Yeah.
Rambling off the top of my head.
No, I appreciate your faith in our chiropractors.
I'm not trying to
Because
do that. I'm trying to think in terms of, if they're already doing it, is there redundancy in having this in multiple places or multiple forms? Are
I
we
don't-
going to create a new informed consent for anything else that we've got coming up here in the next, couple of weeks, months, whatever?
yeah, my concern about leaving it to the docs to have their own particular informed consent, particular to breast thermography, is that they just won't. They won't explain that it's investigational. They won't explain that, all these things that clearly the board was concerned about. They just won't. I mean, we have one case that I'm thinking of that we were required to, we were requiring of that person to have very specific informed consent because of the behaviors he did, and he just blew it off completely.
You read my mind, Cass.
Yeah. Yeah. And so then literally years later, we had to go back into his records and say, actually, this isn't the appropriate informed consent. We told you what to use and you haven't been using it. So, to that end, I'd rather have something very
Too much, not
clear.
enough.
Yeah.
I
And so-
like it. I think I agree. I think with this entails a lot more than what we do as chiropractors as far as the disrobing, things
Yeah.
like that. So
There's
I like
definitely parts
it.
in there about how it's actually going to be conducted, and also that it's that it's an adjunctive screen in addition to mammography.
Yeah.
Like right there, the patient should put it together that, oh well, I need to do both. It's not the end of the road.
Right.
Okay, I'll stop playing devil's advocate.
Would the committee be comfortable with me making those changes as far as bringing it as a second page and then just going to the board rather than bringing it back for review?
I'm good with that.
I approve
Okay.
that. That's
All right, then I will do that. Thank you. I just was realizing, I don't know what, because I was dealing with the appendix. So it's like, oh, yeah. All right, let me stop sharing on this. And saving. My dogs are snoring, so if you hear really loud snoring, just bear with me. It's not me.
Oh, I may end up with a lot of meowing. I've got a cat that has a security stuffed animal,
Oh,
and he'll pick it up and then whine, much like he's got a trapped animal and wants to bring it over and show it. And so, if I ignore him, he keeps it up. So if you see me reaching off and slapping at the cat, you'll know why.
all right. The next one is cupping. And here, let me share. bigger. So talk about a very simple, very streamlined policy.
I like it.
Well,
Bringing up
and
things that didn't open.
yeah, the
Well, it makes it
original.
specific because the problem was we had it, I think, under like
Oh, you froze, Seth.
instrument.
There, you're back.
Sorry.
Do we have
Yeah,
it?
there we go. Sorry. Oh, I think we had the cupping under ISTM, under instrument assisted, and it didn't really fit there.
Yeah. Well, and we've had questions about, what type of cupping and then the whole wet cupping thing. And the wet cupping was supposed to go to ETSDP. We kicked it back out to folks who are, if they're interested in doing the wet cupping, then come back to us with your application for the committee to review, and they never did. And so as far as this goes, wet cupping is, I would say, is not within scope if we haven't reviewed it. And the original P&P had kind of language around this was determined to be within scope, but no type of device was indicated, or not what type of cup was indicated. And I thought that's kind of superfluous. I think we just leave it at cupping and go from there.
Because there's so many variations of equipment on this.
Do we have a general definition of it? I don't, in here, it doesn't say anything. So all you're seeing is, well, they're doing cupping. It's within the scope, but do we have any further explanation of what is involved in the procedure? Do we need that?
That's a good
I think
question.
a lot of our policies don't dive into explaining, because then we open the door to somebody who says, well, that's not right. I want this way. It doesn't read the way I like it. So.
Yeah, but looking at this, I've had some people that have done cupping. I'm familiar with it in a general sense, but if looking at this without any other background, it's like, what the heck? What is it?
Yeah, and I think that could be true of a lot of our policies, frankly.
Is it something we could describe in, say, a sentence or two? It says whether cupping is within the scope of practice. Cupping is the use of, and then put it in a brief description. I don't know. Again, if this manual is to potentially be reviewed by the public in addition to the doctors out there, they're going to see this and not know what the heck it is. At least that's my reaction when I look at it.
Don't you feel like, who just breezes through a P&P guide just like, I wonder what's in scope? Versus like, I'm doing this in my office, I need to find out if I'm up the creek on it. And then you go and you look up like, oh, cupping, there it is.
Would it be helpful to just maybe state that wet cupping does not follow into this policy?
That's probably not a bad idea, so people don't think, oh, well, cupping is cupping. Like, not so much.
Right, exactly.
Should I even go as far as what cupping is not included within this policy and is considered outside the scope?
I'm just looking to see if you search for cupping, what type of definition you get.
I was just looking, and the one I came up with, just a dictionary search on whatever this is, Bing or whatever, it says, cupping, a therapy in which heated glass cups, see, they're already in no trouble. Heated glass cups, they don't have to be glass, are applied to the skin along the meridians of the body, creating suction as a way of stimulating the flow of energy.
And that's the acupuncture, because I was just going to bring that up, that I've had cupping before from that, and they use Moxie with it or whatever. They'll put it in to the cup and pull it out and stick it on you. And so I don't know if we have to say that then too, that nor with the utilization of heat.
Yeah.
Well, I suppose you could, I don't know how else you'd heat it other than that, I guess, unless you
see, but I do
had
cupping
them warmed in a boiling, yeah.
Yeah, and I don't use that technique because I'm not trained in that. I use like silicone They're made by Rock Tape. But I also know people who use ones that have like a suction device, like a pump that has no heat at all. So there's a lot of variation in the equipment. It's still cupping, but it's not.
And we have
You would
both
see
of those
in
on
these medicine
campus.
practice.
Pat, when
WebMD
you
has,
teach, sorry.
well, we're both thinking the same thing. I'm looking at the definition on WebMD saying cupping is an ancient form of alternative medicine where a therapist puts special cups on the skin for a few minutes to create suction. The idea is to draw blood to or away from parts of your body. And then people get it for many reasons, including pain, inflammation relief, relaxation, well-being, and as a type of deep tissue massage. It tells me more than what we saw in the policy. I don't know if we want to use all of that. But at least that says something as to what it is being done. But as if we want to go with what it has here, that's the committee's decision. I just would think that you'd want a little bit more as to what it is, other than simply saying it's within the scope.
So Tom, so I have, cupping is defined as using a cup-like device on the skin to create suction for the purpose of.
This says
Blood flow.
purpose to draw blood to or away from parts of your body. I don't know if I really like that.
Yeah.
Yeah, I don't even know if you need to put why. If we're not using it for other policies, I don't know.
What if you just put suction for therapeutic purposes?
There you go.
Yeah, that's great.
There's on this definition, it says suction is created either by heating the air inside the cup or by using a mechanical device. That makes it pretty clear.
Heat or mechanical means.
Yep. Or a mechanical device. Yep.
Oh, that's why I couldn't find you guys. You're on the other tab.
So does that make sense? Cupping is defined as using a cup-like device on the skin to create suction using heat or or I think means probably mechanical means for therapeutic purposes.
I think that's good. Then we'll
I think it
work
is
with
too.
people.
Yep.
Yeah.
It's better than not saying anything.
Yeah, no, that's a good point, Tom. Okay. We good to have this go forward?
Looks good to
Okay.
me.
Yeah.
Sure.
And I'm glad we're addressing the wet cupping because it's just we get that question. I know Craig's tired of that question.
Well, you have those people that always say like, well, it didn't say it wasn't in there.
Yeah, exactly. All right, let me stop share and save
I didn't
this.
lie. You just didn't ask the right questions.
Right. The whole omission thing is a drag.
Exactly.
All right. Look at us flying through these things. All right. Now, substances and supplements. Seth's favorite.
Love it.
All right, let me share. All right. So this is kind of our preliminary. And here we have it spelled out again, ETSDP. So thank you for that recommendation. Any changes here first, and then we can get into the list.
I didn't think so.
I think it looks good.
Okay.
Yeah.
And then And the P&P, the original P&P, had all sorts of over-the-counter, sub headers and sub detail. And I was like, look, we can just make it very broad. And clearly there was some controversy at some point around colloidal silver that I don't know about.
Kat, is that taught here?
Sorry, Jackie?
I was just asking Kat if it's if we do teach as utilized in chiropractic colleges, and I suppose that could be any chiropractic colleges, and it doesn't have to be us. Sorry.
I don't know if we teach that here. I mean, I haven't seen it anywhere.
They used to.
We used to, yeah.
Yeah.
I could reach out to Chad. He teaches like botanicals class, I think, and see if we still do.
Kind of like Argerol.
We do talk about Argerol.
Yeah, yeah. I mean, when I was in training there were people that were making it like in their basement.
Yeah. Thanks.
I don't think anyone's that hardcore anymore.
I'm not kidding you. There was a guy that made it and sold it to other students to use with their patients in the outpatient clinic.
We
Black
do
market.
still use that too
We do still use
for
Argerol.
what's that called where the toothpicks go up for sinus
Nasal
drainage?
specific or
Yeah.
whatever it is.
Well,
yeah.
Yeah. Just put your head over a bucket.
Yep.
Just let it drain.
Maybe some
I could have
salt
a
comes
student
out.
that's a spokesperson for that. They loved it.
So
This
do
guy
I
swore
need
by
to
it. Made it in his basement.
do I need to make any other like exceptions or things that are not within scope that come to mind? Like
Good man.
intradermals? Is this
That was one that I've never seen an intradermal for allergy testing. Because that's like skin prick.
that's what yeah.
As far as yeah, we can't do that. Because it's technically like depositing something in the skin like an injection. It's a gray area. But I also don't know anybody who uses intradermal for allergy testing. I don't know a lot of DCs that do allergy testing in the first place outside of my office.
Well, and that's something, I mean, so this was the part of the original P&P that intradermals for allergy was okay. So I don't know.
Do you want me to go back through my version and see kind of what I yanked out and said that's
Sure.
yeah, let me go back through my version.
Because I think you had individual policies, right, for all these?
I've broken them all apart, yeah, because I was like that, like
Yeah.
they don't even make that anymore, et cetera, et cetera. So
Yeah.
Do we
I've got
need
to hit the
include
road.
in-
Sorry
go
to
ahead, Seth.
bow out. Cass, I'll look over that my drafts and my policies on that wonderful substances and everything else, and I'll shoot it back over to you. We can talk about it next week or this week.
Okay.
All right. Thank you guys. Sorry I've got to
All
go.
right.
Thank you all for coming today.
Thanks, Seth.
Take care.
Bye.
Oh, you're leaving, not us.
Yeah, I'm leaving. Bye-bye.
I do
All
know
right.
of a clinician that does refer for allergy testing, like they'll send a sample to this patient and the patient does it and sends it back to the company.
Uh-huh.
Is this more within an office? Like that wouldn't be considered. I was just wondering if does a certain type of allergy testing have to be added within the scope, or when it's sent out, is that more you're just referring for that service and then but then they read the results, the clinician does. I don't know. I'm just asking.
Yeah, I don't know either. I think it's going to be something that the board will want to weigh in on for sure.
Yeah.
But that's the one that caught my attention the most, other than colloidal silver, and I wasn't sure if it's still being used or if it's still such a thing.
Yeah.
I haven't heard that term in ages.
And then can someone tell me the difference between clinical nutrition and nutritional supplements? Isn't clinical nutrition like helping people with their diet and the like, and then nutritional supplements are the actual vitamins and stuff? Okay.
That's what I would say, yes.
Okay.
Yeah, that's my take too.
Thanks. I was assuming so, but I wasn't quite sure. And so we also have botanicals here and herbs. Are they the same thing or are they not the same thing? Or can we say botanicals and herbs?
I'm wondering now with this, with us adding the naturopath degree to the college, and we'll have like an apothecary, and I'm now wondering, but Kat Leslie Fuller teaches botanicals and herbs in a class for the chiropractic students, correct?
Leslie. It's Leslie, and then Chad also teaches some type of nutritional class.
I could ask him too if you, or Kat, if you're talking to him about something else, you can ask about those being combined.
Yeah, it's just an FYI. I just looked it up. They are different. Botanicals can include herbs, but botanicals encompass a broader category of plant-based substances with medicinal, therapeutic, or other, whereas herbs are referred to leaves, flowers, stems, or seeds of a plant.
Got it. Okay.
So they are different.
Good answer.
That makes sense. Thanks,
you, Craig.
Okay. So
educational still in me.
Good job.
We're glad. We don't ever want that to leave you, Craig.
Yeah, I had the thought that they were different, but I wasn't sure. You know, I don't deal with all this stuff all the time. All right. So, anything else? I mean, I think we cover it pretty well with that this is not exhaustive or static. That, you know, we can add or take away anything that we want to do on here. Craig, are you seeing in some of our cases anything that comes to mind that should be added to this list for within scope or outside of scope?
Ivermectin.
Oh shit, that's right. I think I blocked that out.
Yeah, I know you did.
So the question is though.
Well, the other one is, obviously CBDs is always coming up. But
yeah,
I know we have a separate policy for that.
But. Yeah, and we actually need to review that policy because it's quite dated now. But as far as ivermectin, so if it's in a dosage that would be appropriate for humans, would it be in scope?
What is this? I'm sorry. I'm gonna what is
this? Essentially, it's a dewormer for animal stock.
Oh,
but people were using it for COVID.
Yeah, we had many cases that folks were recommending it, referring it for COVID. And at the time, it was really rather ironic in that I was the interim ED for the veterinary board as all this happened. And so my chiropractors were referring it for their human patients, and my veterinarians weren't able to access it for their animal patients because the chiropractors had all purchased it all. So it was crazy making. But you could get it, I mean, you can get it from a farm store.
Okay, so my question was, is it still considered a prescription medication? But if it's available for animals without a prescription, then yeah, you have people that may try and circumvent that.
Yeah, and we did. And OHSU had a huge poison control count because of it. Yeah, it was bad. Thank you, Craig, for reminding me of that dark history.
Yeah.
So I'm just going to throw ivermectin down here. I mean, I could put in parentheses animal dosage or something. I mean, I don't know if we want to actually even tip our hat to the fact that you could possibly use ivermectin for human consumption. I don't know.
Well, it has been used on some parasitic infections, so
yeah.
I'm trying to see if I can find something that says anything about its status as far as a prescription drug. And what are the parameters on that? And I don't know off the top of my head. Worm infestations, mites and insects. Adverse history.
It looks like you can buy it from Walmart and Amazon.
Mm-hmm.
Well, if they have next day delivery, what the heck?
Well, they may use a drone for that one and just deliver it right
Yeah.
to you.
Yeah, a invisible drone.
So,
Yeah, I've tried searching to see as far as a prescription requirement, and all that comes up are all these places where you can order it online. Okay, ivermectin is a prescription medication used to treat parasitic diseases in human. It's important to consult your healthcare provider to determine if it is appropriate for your specific condition before obtaining a prescription.
so it's
So
supposed to be prescribed for human use.
at least for human use, yeah.
Maybe you put that prescription needed for human use, and then they know why it's not within the scope.
There we go. I can't even believe I have to say that.
And
You
then,
might want to put
we'll be ready for the
oral.
next COVID infection.
Prescription needed for oral human use.
Yeah, because it looks like you can get a topical form for head lice
Delicious. Great.
or rosacea.
Headlights almost sound like headlights. It really confused me. Oh, this light will come on now.
Okay. No, that's a really good ad because goodness, why didn't I think of ivermectin? My God, I was literally black that out.
Do we need to add anything about CBD, like see other policy so that they know, or is it just leaving it out good?
I think because it's in another policy, I think we just, it's fine. Because I think they'll be looking for CBD or THC or
exactly.
particular.
Yeah. Okay.
Is the index or table of contents or whatever highlight that, and is that CBD close to whatever this thing would be in that list? So that if you're looking in there, it's like, oh, that's a separate entry.
Yeah, it will. We haven't done anything with the table of contents yet because we just wanted to get the body done. But yes, it will tag all these policies separately. Okay. Well, if everybody's good, I know Seth was going to get back to me about the intradermals. I'm going to highlight this just for that. And depending on what he comes up with, do you want to see this back at our next? I think our next meeting is like mid-November, so it's not too far away. Or are you guys okay if Seth, if this is the language that was within his original, we good to go to the board?
I personally don't want to see it again.
Okay.
I don't need to see it again. I would just like to know what the final decision was.
Okay. Then I will send it to the board after Seth's review, but before that, I will let you guys know what the determination was. Okay, let me stop sharing. It's going to be huge to get this one done because it's just been kind of hovering over us for a long time. Weren't sure how to bring it all together. Right. And treatment of family members.
Mm-hmm.
Okay. And I think Seth had something he wanted to change so long as to something else, and I don't know what it was.
I think the biggest concern that I have, or we should have, is that it emphasizes that, yeah, they need to be treated like a regular patient with chart notes and everything, but there is, especially if you're getting into something where there's a liability issue, it would be nice if we had something that would at least remind them to think about that aspect of it, that it may actually compromise them. But I don't think that needs to be in the policy either. It's certainly could screw up somebody's personal injury case if a principal within that family who could in turn benefit from any settlement is rendering treatment and potentially profiting off of that as well.
I mean, we could put in, there may be legal ramifications for treating family members referred to independent counsel. I mean, we could put that in there just to flag it for people.
Mm-hmm.
Let me just see what that looks like. Oops. I
don't know if I like legal ramifications because it implies that you might do something that violates the law as opposed to interfering with negotiated settlements. But it's hitting close home for me because 2 years ago, my daughter was 8 months pregnant. She was in a crosswalk, traveling on a walk sign when an Uber driver made a turn and hit her in the crosswalk.
Oof.
And subsequently ended up with early C-section. Granddaughter was in the NICU for 2.5 weeks. And I made a specific point to stay as far away from any of the treatment aspect of it, other than just make sure they're documenting this. And I didn't want to be in a position where, I'm sitting there treating or recommending anything on treatment or consulting on it when, I may not directly benefit from it, but, I've got somebody who is going to be somewhere down the line getting a settlement. But I use that illustration in the class I teach in documentation to ensure that whoever or whatever you're treating, not the family member, but the fact that your records could have a bigger impact than what you think in terms of just a musculoskeletal condition, that may go dovetail with other clinical things related to the injury. But so.
I mean, does this cover it?
Well, it says that there is a concern. I'm not sure if again, I'm not sure about legal ramifications. I don't know.
Actually,
if there's a synonym for that.
Legal. What's the word I'm looking for?
I don't know. Right click on is that tied into the Microsoft thesaurus? I can't talk this morning.
Thesaurus?
Yeah.
No, because it's in track changes.
Yeah.
Look. This on a different screen. No, stop. Outcomes, implications, repercussions, consequences,
effects.
Legal effects to treating.
Is concern too broad a term? I mean, that at least would cause you to maybe talk with your attorney and see if there's something.
I think concern is actually appropriate because I think it's not nearly as alarming as, oh, we're telling you there's ramifications here, but there may be concerns, legal concerns. I don't know. I feel uncomfortable telling them to seek legal counsel, but how
about discussion with legal counsel may be appropriate?
Yes, there we go. There we go. A whole lot of maybes, but you know what? It's all on you.
Yeah. Well,
okay. I'm liking that. Are we okay? Should we put this forward to the board?
I'm just looking to see if there's to get rid of your maybes.
I mean, I'm fine with the maybes.
Yeah.
Go ahead, Craig.
Yeah.
To address the so long as chart notes and records, how about at the end of that saying something like establishes doctor-patient relationships and necessitating records or something that way? Is that what Seth was looking at?
Maybe.
Like thus establishing a doctor-patient relationship.
How about treating family members? Well, what was I thinking? Treating family members establishes a doctor-patient relationship as with any other patient, and chart notes and records need to be kept appropriately or something like that.
Establishes. So let me look at that. Treating family members establishes a physician-patient relationship requiring chart notes and records as with any other patient. Does that get to it?
I think so, yeah.
You can maybe even get rid of as with any other patient, just requiring chart notes. Because that's one thing when we do investigation, a lot of times they don't take notes for family members, is what we find and stuff.
Yeah. Okay. That's good. That's a great change, Craig. Thank you. Okay. We good to go? Okay, awesome. Let me stop sharing this. All right. So that is the end of our agenda since we don't have Susan's minor surgery policy and stuff. I'll look through the P&P itself and see what else we have to do. I know we have another meeting in November, but we're kind of chugging along. It's getting really down to the nitty-gritty at this point. And Seth and I looked at the abandonment, if you remember that piece. And we were going to do a policy and a rule, and then we realized, you know what? I think we just need to go to rule immediately to rule rather than kind of do the double step of it, just because we do get many questions and concerns around what is patient abandonment, and kind of people go on the far sides of that, where they either ditch clients mid care and without a reason or explanation, or they hold on to patients that they really shouldn't because they're afraid of abandonment. So there's no kind of midline. So I think clarification in rule would be appropriate. And anything else? Any questions? Any thoughts of where we should go from here? Other than I'll like I said, I'll do another revision of the P&P and see what I can assign out in November. Or do we even want to meet in November? I mean, I guess that's a
That was
question.
my next question. What's the date on that? Is that the 21st?
No, it's not the 21st.
Okay.
It's the 7th, actually. So it's 3 weeks from now.
Yeah.
Do we want to meet or in our next, let's see, in December? December is December 12th.
Yeah, lovely. I'm going to be out of town on the 12th. And I know going back on the 21st of November, which would be the third Thursday, I'm out of town, and I've got a follow-up with my orthopedist on the 7th, right in the middle of when we'd be meeting.
Yeah, the 21st for us is actually our board meeting. So that's not going to fly. My thought is, why don't we cancel November and December, since it's holiday season and people are kind of focused and on vacations and doing work until the new year, and come back in, when is our next, I don't know if we have meetings established in January yet.
Not yet.
Doesn't look like it. So why don't we just do that, everyone? And Heather will work with getting schedules out for the 2025 year.
I'll be sending out a Teams forms to take a vote.
Awesome. Sound good? Okay.
As long as we don't cancel the holidays.
Holidays will still be in effect. But thank you all so much. And thank you, everybody. And we'll get these to the board. Thank you for all your work and dedication. I really appreciate it.
Right.
Take care.
Happy holidays.
You too. Bye.
Bye, everybody.